Welcome to the Civic Circus Podcast. I am Spencer Duncan.
And I'm Sarah Karns Vincent.
Let's start the show. Well, thank you for being here. I really do appreciate it. We're going to talk community health a little bit, right?
That's my whole thing.
That's right. So tell people before we kick into it who you are and what your role is and why we're going to talk community health with you a little bit.
Okay. So I am Sarah Karns Vincent, the director of LiveWell Shawnee County, and we are a grassroots health and wellness coalition for Shawnee County specifically. There are health coalitions all across the state. Our work is focused on increasing health outcomes in Shawnee County related to what is negatively affecting the county the most.
I remind people, people know this, but Topeka's in Shawnee County, which is why I always remind us, so when we talk Shawnee County health particularly, and we make up a majority of the county in terms of population and land space, we are a lot of that health factor and a lot of that number that feeds into this stuff. So let's start with this. If I was Shawnee County and you were a doctor and I came in for the first visit ever, what would your assessment be in general after you took a look at me and said, oh my, or would you be like, all right, we got some work to do, or are you calling an ambulance?
Hopefully not that. It's a good question. As we see all over the country in terms of health data, it does depend on the zip code you live in, probably.
Yeah.
I assume you've heard of the social determinants of health.
Yeah.
So those
that doesn't mean everyone else has.
Right.
So.
happy to talk about those. So those show us how it really, they say roughly 80% of someone's health is impacted by where they live and the environmental factors around or a part of where they live.
Sure.
And so in Shawnee County and Topeka, we can see, looking at data, that that the 5 domains of the social determinants of health impact people's health for each zip code,
Sure.
each area. And so if you came to me and I was a doctor, I would look at where you live and I could ask you questions related to the 4 priority areas of health in our priority areas in our community health improvement plan, which are behavioral health, food access, health equity questions, and neighborhood safety and housing questions. And those would all tell me so much about your health and what you might need.
I think that one of the reasons I think that's important for people to understand those distinctions, especially as it relates to which area of town you live in or your zip code, is, look, we feel like a small town at times, and we like that feel as a city and even as a county, but we're not. I mean, the city is 125,000 plus people. The county is almost 200,000. So while we like to think and have that feel, we're a much bigger metro. And so it sounds silly sometimes when people say, what do you mean different zip codes can matter in Topeka? It's just Topeka. And we're like,
get across town.
Right. We're like, no, that's the point. One size doesn't always fit all in the city as we're trying to figure out any policy, but even health policy. And so I think that's always a good reminder for people about, yes, we like to think of ourselves as this one small community, but we're not. We're a lot of people packed into one area now. We are, and that those distinctions do make a difference.
Mm-hmm. And it can change so quickly. You can go a few blocks, and the data around that area can be very different from a different neighborhood nearby.
So before we talk a little bit more about the breakdown of some of the what the county looks like and the city looks like in terms of some of those health metrics, talk about how LiveWell itself came to be, because obviously we have this Shawnee County Health Office itself, which I remind people serves Topeka too. As most people learned that during COVID, when the cities were saying, had concerns like, I don't know, talk to the county. They're the ones who oversee the city on these issues. And so that was people's first lesson in that, how this kind of works. But talk about how the concept of the LiveWell piece of it came into being.
Sure. Yeah. So in 2008, with the Affordable Care Act, every nonprofit hospital was required to produce a community health improvement plan. And so from Stormont Vale doing that plan, I suppose I'd have to check on this, but they probably were required to do a needs assessment.
Probably.
And they kind of have their own plan. But so they were required to do the needs assessment. They surveyed the community, Topeka and Shawnee County, to see what they saw as the most important health needs in the community. And so we got all that great information, and then you have to decide what to do with it, right? So from there,
compiling sometimes the easy part. It's
right,
and then now we have it. Now what?
The execution of yes. So I say we, and I didn't start my role until
you're part of the we now. It's all right.
Yeah. So we then created at the time Heartland Healthy Neighborhoods, which has become LiveWell Shawnee County, to execute a plan to take what we knew and do something with it.
Mm-hmm. Yeah. And so, where does all that data come from? I mean, where does it all? What's the collective that you're pulling from to help compile that information?
Sure. So we take information from individuals through that survey that I mentioned, but then we also hold that up with or next to data from places like Kansas Health Matters and county health rankings and roadmaps. Shawnee County Health Department has a wonderful epidemiologist who I get to partner with to understand all of it.
Right.
We pull a lot of data from the state, and then Josh, the epi, tells me what that means.
Right. Defines it all.
Yes.
Well, and it does come out in a very good-looking, helpful, and in fact, I meant to bring my copy. I have actually a couple copies of the most recent report, which is great. It's there's a lot in it. I mean, it's not a easy read in the terms of it's not a quick read, but I guess it's to say it's not a quick read, but it is an easy read. It's not just a bunch of numbers on pages after pages. It does break down what the data is, what the data means, and then it also has solutions. I mean, here's what we can do X, Y, and Z as a community or should be addressing. And so how do you guys though make those assessments internally? I mean, you as we said, you get the data, you compile it, you've now sort of analyzed it. What is the next internal step of deciding what you do next with it?
Yeah. So we have 6 impact teams that make up the coalition, and those are we created those based on what the CHNA, the Community Health Needs Assessment, said we needed to focus on, and what other data sources tell us are the issues. And those impact teams kind of go through this process that, in a nutshell, says, like, where are we at? What assets do we have in the community and among our collective group that we could leverage to make progress? And something we've really talked about with this most recent iteration of the CHIP is that we can write this very detailed plan that includes all this data. And we can work really hard as a health coalition made up of community organizations and individual volunteers, but we have to also share this with the community so that those who aren't involved in the coalition can also be a part of the work, because we're not going to make good progress unless everyone's invested in the community that they're in.
So how do you come up then with whatever your determinations are? So as I said, there's recommendations or action steps that can be taken both by the community, by government entities like the city and the county and others. But what does that process then look like? Because again, some of them are probably pretty obvious. If you have an issue, we know what the solution is, but some of them may not be. So how do you make those assessments as to what those recommendations should be?
Sure. Yeah. So we have county health rankings and roadmaps is a really good source where they share proven interventions that have worked in other communities, and you can narrow it down to find communities that are very similar to yours in terms of various demographics. And so we rely on those some. We also ask partners that are on the coalition what works for them, or what is they're seeing progress in at their organization that could then be scaled to make community-wide progress. And then also some of it is a grand experiment.
Right.
And something we're trying to do more of is monitor and evaluate what is working and what is not. And a lot of that support from the epidemiologist that I mentioned is helpful in that effort. And so hopefully we'll, through that process, see oh, this isn't really working.
Yeah, it's not working.
Yeah. So we need to kind of pivot and
I'm sure through that process over the years, at some point, something that's worked somewhere else has been brought here. And then there's that moment of, what? Why is it not working? It's worked in these other areas. Why is it not working for Topeka and Shawnee County? And then you kind of have to, I guess, workshop it from there. But I'm sure that's happened at times.
Oh, yes, certainly.
Yeah, which can be frustrating because I'm always steal it from someone else and it'll work. And then when it doesn't, you're like, I don't understand. This worked for everybody else. Why are we why can't we make it happen?
Mm-hmm.
All right, well, let's start with the good before we get into the quote unquote bad, I guess.
Sure.
So where are we doing either okay or where have we seen improvements as a county and a city in terms of some of these metrics over the last several years?
Sure. So something I think worth celebrating, we talk a lot about behavioral health care and mental health care. And there's certainly a lot of needs there. It's the number one priority in our community health improvement plan. But what I have recently learned is it's not for lack of providers. We actually have a lot of providers, in relationship to the number of individuals or in reference to our population.
Sure.
So we have a lot of providers, which I think then leads us into talking about, okay, what does access to those providers look like?
Right. How do they get in?
Right. Or how do you implement preventative programs so that people aren't needing to go to those providers in such a crisis situation?
Yeah. Somebody has to pay for all of that, right?
Right.
And to your point, it's twofold. It's getting them in initially, and then it's whatever care they need afterwards so that they don't end up back there repetitively over time, which becomes difficult for their life situation, costly for the system. One more person instead of a new person in, it's the old person coming up. So yeah, it's a whole, and that's why I've said for years, I know, particularly as it's related to mental health and addiction type, but behavioral health issues, the state for years, Kansas is one of the few who haven't done Medicaid expansion. And that's an area where there was a lot of money that went towards that. It's never going to happen in Kansas. I think and that's fine. But what I've always told legislators is, I don't care if it's Medicaid expansion or something else, just help us figure out what it is. If all I have to advocate for is something like a Medicaid expansion, then if that's the only tool you're offering me, then I'm going to advocate for that. But if you have another tool, I'm not married to Medicaid expansion. I'm married to the concept of something that will provide people some sort of access to help pay for these services. Because, there's only so many federal grants. There's only so many state grants. There's a few city dollars and county dollars at times. But once those run out, if people can't get in the door, it doesn't matter how many providers we have if they can't offer expand their services to help everybody who needs it.
Right.
Because they have a cost too. Even if they're not trying to make money, people need to get paid and pay the bills.
They sure do.
So,
Yeah.
gotta keep the lights on, and that comes with a cost.
Yes. And if we're not going to be able to provide that kind of program that you're talking about, like how can we make sure people are allowed to leave work so that they can take a mental health day, or make sure that they can get childcare while they go to take care of themselves or something like that. Like, what can we be doing?
Yeah.
We're trying to look at what can we be doing to kind of like offset those.
Yeah, because obviously the easy solution is just more money. We all know that. That's the solution to half our problems. More money would be great, but in lieu of that happening, right? I think that's why those conversations are important, not just from the recommendations that come out of things that LiveWell does, but then to the work groups that you have and the organizations you folks are working with on the ground to see what those solutions are.
Sure.
So that is a big piece of it. So I'm glad to see we've seen some improvements there. But
It kind of leads to like another problem,
right?
But at least it offers some clarity on what direction we can take in terms of our work.
All right, so let's get to what are our problem areas. I'm sure there's more of these than successes, which makes it sound worse than it really is. But, I always tell folks if you're not willing to recognize the problem, you can't solve it.
Yes.
It's kind of like we get a lot of studies at the city sometimes, and then half the electeds are like, oh, well, I disagree with you. Well, they're actually just trying to tell you what you asked them to tell you, which is where are deficiencies. That's the only way we're going to fix them. And I know people look at some of these reports sometimes and okay, let's not talk about that. It makes us look bad. And I'm like, well, it's just the facts. What makes us look bad is if we don't deal with it. Right. Talking about it's great. It's not not addressing it that makes us look bad. So let's go. What are some of those things we're working on that we need to? Yeah, the bad part of this patient that's sitting in front of you.
Sounds good. So our CHIP has 4 priority areas. That last one we break down into 3 parts, so it gets a little confusing.
So it's 7.
So it's 7.
There's math. Now there's math, health and math.
I won't do math too much. It's not my strong suit. So the first one is behavioral health, including substance use. Substance use is a big problem in our community and affects behavioral health or mental health. Then the next one, and this is the first time this has been a priority area in the CHIP, but is neighborhood safety and housing. Those are 2 very big things.
Yeah.
But because this is the first time it's been a priority area, we've kind of lumped them together. Gonna leverage what's out there, the good work that's being done, and hopefully make some progress on those.
Well, I think that's important because, and anyone who ever listens to me anytime knows I'm a broken record on this, but I think it's critical. I mean, housing is a key to lots of problems.
So,
I mean,
behavioral health, for instance.
Right. I mean, if somebody knows they have stable housing, a lot of other things fall in place. They're going to be healthier individuals. They're going to be able to not worry about things like their jobs. They're not going to be able to worry about some of that public safety issues you talked about. They're going to make sure that the kids are getting consistency at school. I mean, it makes sense, but it's sad we have to point out all the time. But it makes sense that a stable housing situation really can key us into solutions to a lot of these problems.
Yes.
So I'm glad as much as it's sad that's had to become a category, I'm glad it is because I think of the importance of it.
Yes. Yeah. I'm glad to hear you say that. And I think it's not always recognized as something that would improve health or community health. Yeah. And so that's really glad to hear you say that. Yeah. So then the third priority area is healthy food access and looking at ways that people get access to nutritious and healthy food. And then the fourth, health equity, we break down into maternal and infant health.
Oh, sure.
The 66604 zip code, which is a really, really big zip code in Topeka, has the highest infant mortality rate in the state of Kansas. Yeah.
Which it has for a while now.
Yes.
So why, I mean, you mean I have this answer I get because we're ultra fit, but why can we not fix that? I mean, because that's one that not just a few years, like many years now, we have continued to lead in that sad category. And I don't know what the answer is. And I don't know what we can do as cities, obviously, but we need to do something.
Right. I mean, the Healthy Babies Impact Team has worked a lot on safe sleep practices and promoting those. They hold a really successful community baby shower where parents or soon-to-be parents can get education on safe sleep and other connections to other support services. So that's done a lot. But we're also looking at some new things for this coming iteration or action period of the CHIP, trying to figure out like what are the other factors contributing to this. Sure. We've got some exciting stuff coming. I think with a grant that we have from Blue Cross Blue Shield, we are working with Dr. Tara Wallace on like some parent support groups offering more of a village for new parents that I think will be really helpful to the community. It's really sad reality.
It is. Have we improved on our STD issue? Right, we were pretty wide. I mean, it's going to be an issue always, and that's one nobody. Sure. I always joke that's one really nobody wants to talk about. But I know we were pretty bad there as a county for a while, and maybe we still are kind of up there. But it got really out of control for a little bit.
It did, and I think because no one wants to talk about
it,
it just got really bad. Yeah. So we're seeing some improvement, but I recently heard from our epi that we're seeing higher numbers again. Yeah.
It's just amazing to me that these ebbs and flows of stuff. But
and people think that it's in high school students. It's not necessarily
the
case.
It's lots of adults.
Yes.
Yeah. Which is what's frustrating because not that a high school student, but I mean, you should know better, people, in terms of go get it treated, go use what you're supposed to use in those situations. Nobody's going to criticize you. Right.
Yes. Look out for the community.
Yeah.
Nice. Yes. And so then the last one is obesity.
Oh, sure.
Yeah. Okay. And that's a tricky one to approach in terms of programmatic initiatives because it's such a side effect of so many other things,
Right.
like neighborhood safety. If you feel safe to walk in your neighborhood,
Yeah.
you
You're
have
going to walk more.
Yeah,
Right.
yeah.
And same thing, a lot of these things are, again, access issues as much too. If you don't have that access to the healthy food or even a grocery store, period, in some parts of
Right.
the city, then what you're eating is not going to be, nearly as well as if you have that access. If you
Yes.
can't access, if whether it's you want to walk in your neighborhood or you want to go use a fitness center, if you can't pay for the monthly fee and there's no fitness center for you to access, you're not going.
You're not going. Yeah.
And so you're trying to find, you either give up, which is
Mhm.
totally understandable at some
Yeah.
point. We get it. Or you're like, I'm making do, but it's not enough. And so,
Yeah.
that
Yeah.
can be tough.
Yes. Yeah.
So,
So that's the bad.
yeah, no, so when you have this information and when you're trying to educate people, I think there's two levels to it. We'll start with, how do you get this information out to the public?
Yeah.
Not just the information of the problem, but the information on how to help them in their communities deal with these issues that they're all facing, that we are all facing as a community.
So that's a tricky thing to do.
Yeah.
I'm
You mean
learning.
people don't like to be beat over the head about their own health?
Right.
Reason most of us don't like to go to doctors and do follow-ups. Right? The old, if the doctor doesn't tell me I have it, then I must not have it.
don't.
Right?
I
Right.
don't. Yes.
Yeah.
And when people are so busy,
Yeah.
that can just fall to the back burner.
Yeah.
And I think it's hard to think about your community's health when you're not thinking about your own.
Yeah.
Getting this out to the community is something that I am constantly thinking about how we can improve.
Yeah.
We've talked about producing a chip in layman's terms.
Sure.
That isn't so data heavy, that
Right.
could maybe provide some clear, easy steps to take.
Well, and if
that
you
would-
break down some of those categories and issues, then the people, because some people, not they don't care, but if they don't have children or they're past that, then
Mhm.
the mortality rate is going to be something. Why do I need to
Right,
worry
right.
about this in my life? But I may worry about the healthy access to food or the behavioral health issues, or
Yes.
so, breaking it down in ways they can digest for whatever's personal to them.
Yes.
And I'm
finding
guessing-
a way to that resonates with
yeah,
them.
and I'm guessing working with all the various groups that you work with across the county
Mhm.
helps to some degree, because then you can use that. They're dealing with these issues specifically, and you can kind of provide them some additional help, and they can kind of do the work a little bit with the people that they're serving.
Yeah,
At least
certainly,
hopefully that's how
yeah.
the network is working.
Yes. I can't be in all the places and,
Right.
and understand all the
Right.
things. So hearing from the partners and then helping the groups to brainstorm what we're going to do and how we're going to get that message out
Yeah.
is a big part of our work for sure. Yeah.
So then, how do you get me to listen? Me as mayor, me as an elected official, my colleagues on the county and the city, even our state legislators who represent Shawnee County. How do you get us? Because we'll tell you we're listening.
Yeah.
And we sit there and we read the books and we're like, yeah, we need to solve this. And then we go about our day, and you guys are probably half the time thinking, hey, we're still here. We could use your help. You said you wanted to help, but you haven't done what we need you to do. So how do you keep, banging your head against the wall, but how do you keep working to crack that nut to get folks like me to listen to you?
Well,
And then actually help you, not just hear you.
right. Yeah. I mean, I would be curious to know how I could do
Yeah.
something differently in order
Mhm.
to be heard. Something that I've heard a lot of coalition, across the state, health coalition employees or volunteers say is coalition work is so slow.
Yeah.
And so, when it's that moment where I'm banging my head against the wall and really trying to figure out what do, I just remember this is slow work. I might not see, the result that I want to for a long time.
Yeah.
But if I keep chipping away at it, no pun intended,
No.
chipping away, then hopefully, there will be some fruit to that labor.
And I'm sure with health issues, it is a different metric, because it's not going to solve itself overnight.
right.
It really
And
is going to
it's
take
constantly
time for
changing,
things
too.
to get healthier. Or yes,
Yes.
something new comes along and you're like, oh my gosh, we finally got a handle on these things.
Yes.
And what is this new thing called COVID that we all now have to upend our lives on?
Right,
But
right.
I think from our perspective, what happens, which happens with everybody, is we get so much, and there comes a point where it gets so overwhelming that the easiest thing is to throw your hands up and be like, since I don't know how to deal with this, I guess I just won't, and I hope somebody else. Oh, we have the Shawnee County Health Department, we've got LiveWell, and they'll figure it out.
Yeah.
When they're sitting there say, well, we kind of can, but it takes a little action from you folks too to help us figure it out. And so I think that's part of it. I think what I tell every group is, you can bring us the whole apple, but I can't swallow it whole, right? And so, give me a bite at a time and prioritize some of the things. So, if the case is, look, I realize as a city you can't help me with all 5 of these categories or 4 of them, but you know what you can help me with? This mortality, infant is ridiculous, and we're not improving. And so let's start there. And then when we see, here's what I need from you as a city, it will make a difference. And then once we can show that result, great. Now can we deal with issue number 2, some more, this problem? And I think that's the best approach, because to your point, so many moving parts, and it gets overwhelming for some folks, elected officials, that it's easier. I always say, Bob Dole, say no's the easy part, because you don't have to do anything after that, right?
Yeah.
But that's not what we want. We want to get to yes. That's the point. And so I always say I think that's part of the approach. And instead of coming with the whole package, which you can provide us, but also be like, today I just want to deal with, can we just deal with this issue and start there? Because then it's something you can wrap your head around. Like, oh, that's an issue I can actually, versus 7 issues. I don't know where to go for. I don't know what to do with that.
And they're like all connected, but then there's like a million different things you can do to try and improve them. Yeah. No, that's really helpful.
And to that point too, I think, and this is just something I've pushed for, and I think I've got colleagues who have come around to this and agree with it too, is I'm not trying to reinvent the wheel. In fact, I can't. That's idiotic. Right?
No one's doing anything
new.
and
the city should not be even trying to get into things it doesn't need to get into when I already have a bunch of others in the community doing it.
Yeah.
So our conversations need to be focused on, okay, I don't need to go start a coalition within City Hall to go help deal with this problem. Coalition already exists. What can I provide you as a city? Whether it's a few dollars, whether it's some additional resources, whether it's a hub to help you guys collect data, whatever that looks like, tell us what our piece is, and then we're happy to hand it off. Because I think whether it's the health issues, whether it's some of our homelessness issues, there's several issues in this community. I've got plenty of groups working the problem. They just need us to do our part to help them fit that piece of the puzzle in, and be like, great, now we can manage the issue. And I think if we frame it that way too, and just say, great, what do you need from us specifically? Because I can't do it all.
Yeah, that actually answers the question I was going to ask you in the question portion. Like, what is the government's role in this work, and how do you fit into it among all the other sectors? Yeah. And I think I can really relate to that in coalition work, because I and our leadership team see all these issues, but we're not going to start a separate nonprofit to address each thing.
Right.
Like, the point of a coalition is to bring people together who know the issue and are doing really good work, but who need some networking, some collective, brainstorming, and because we believe that we're stronger together than separate.
And I think sometimes it's hard for us to even for us to define what our role should be in it, because the hardest thing to do as whether you work for a city government or whether you're elected, is to tell people, I can't fix that problem. It is a real problem. And again, maybe I can put you there, but I can't fix it. That's hard to say, because then people are like, oh, you're a jerk. And you're like, no, this is not a problem government can fix specifically. That doesn't mean we don't have some piece in it, but we can't solve it. So that's always hard. But I do think to that point, some of those are pretty easy to figure out right up front. Some of those are a little harder. And so I do think sometimes what happens is a group will come to us and say, we need you to help with this. And we're like, that doesn't sound right. That doesn't sound like something you even want us involved in because of our bureaucratic mess.
Right.
But don't take that, but come back. Like, just because we couldn't help with this piece, that doesn't mean you're going to have another piece that then makes sense to us to say, oh, you know what, that we can help with. Didn't make sense over here, but that makes sense. And I think people get frustrated with that first part, like, oh, so you can't help at all. I'm like, well, I can't help with that, but find me something, right? And we'll make it work. Yeah. But that is hard. That's because we want to be everything to everybody, and
people expect that,
right? And they do, and I get that. But that's that balance of, Now, when it comes to things like public health, I do view that as part of our job as government, besides keeping the water running and the roads done, and public safety is, public health is keeping people safe. There's a safety component to that. And so I do think that fits in a little more with at least some of the role that government should be playing to make sure people are healthy and can live a decent life in your community.
Yeah. It goes back to those social determinants of health. And the government plays a huge role in influencing those.
Yeah.
Sure.
Yeah. Sometimes worse if we're not careful.
Yeah.
On a lot of these issues that people hear me say this all the time too, because it's true. We can be way more reactive in local government than the state can in the way they operate, and then the feds. And that's why we have different levels of government. But sometimes when it comes to some of these health issues, we have the least amount of resources to be able to help. I can't just go pass an ordinance tomorrow that's going to solve half these problems.
Right.
Some of those issues I can, or I can't just redirect a few things. These are a little deeper problems that are going to take some time and patience and strategy and
money.
Right. And money, always money. See, it always comes back to money.
That.
So how did you end up doing this?
So I used to work in at a food bank.
Okay.
I was involved in nutrition education. That was my job. And out of college, I was like, I don't know. I just want to help people.
Where'd you go to college?
K-State.
That's fine.
Is that
My wife
okay?
went to K-State.
Okay.
I went to KU. She went to K-State. We've made it work.
Respect.
It's all good.
Yeah. So I was doing nutrition ed, wanted to kind of branch out, do something different, worked for the state for a little bit, and this position became available. And I thought that sounds like a really good way to help people.
Yeah.
And I had been involved in Heartland Healthy Neighborhoods, now LiveWell, in my work at Harvesters. And so I thought, I've always enjoyed that. I'm going to give it a try. And,
So where are you from originally?
I'm from Holton.
Okay.
Yeah. So I've been.
Did you grow up in Holton then? Okay.
Mhm.
Yeah. So you went to Holton High and all that.
I
good
did.
stuff. Yeah.
Yep.
From there
Class
to
of
K-State.
09.
Class of 09. There you go. So from there to K-State, and then so you stayed in Kansas.
Yes.
Yeah,
Yeah.
which is good.
Mhm.
Me too, mostly.
Yeah. You're from Topeka?
I'm from Topeka.
Okay.
Yeah, I was born here. I mean,
Mhm.
I went to KU, and then briefly after I graduated, I did a brief stint in Austin, Texas, and another brief stint in Rocky Mount, North Carolina, which is
Rocky
outside
Mountain.
of Raleigh. That's right. So that's actually Rocky Mount. I told you was weird because it's both the home where Krispy Kreme was invented
Oh.
and Carl's Jr., which is Hardee's. So they love their fast food down in Rocky Mount, North Carolina. So among other things,
They might need to pass a policy
right? That's
about
right. Yeah, there's like
that.
it was a town of like 55,000, and no joke, I think they have more Krispy Kremes than per capita than anyone in the country because that's was its hometown. So go figure. But
I ate a bunch of Krispy Kreme before I had appendicitis as a fifth
See,
grader, and now I just.
I'm allergic to eggs, so I can't even eat Krispy Kreme. So yeah, I know. See, there's a health issue
why
I
you
have.
left.
Yeah, that's right. That's why. That's right. But yeah, then I ended up back in Emporia briefly. So that was over like a 3-year period, but came back to Topeka, and so mostly I've lived here most of my life. When I say most of my, I have a friend who's like, you can't say you're a lifelong Topekan if you lived briefly somewhere else. I'm like, okay, maybe that's fair, but that seems like 47 out of 50 years feels pretty.
Feels
right.
It feels
Feels pretty
significant.
solid. I feel like I'm okay. So.
I think so. And the fact that you came back, I think that's
right.
something.
Right.
Yeah.
So no, it's fun. It's so I'm obviously, I mean, I love the community, and so, still have friends and family here, and obviously trying to do my best as a mayor role. But I mean, I want people to stay healthy. And, So obviously the job has brought you back here to this area, but you've wanted to stay, so that's a good sign. You haven't tried to flee.
No, I can't imagine living anywhere else but the northeast corner of the state. Yeah. And I really like Topeka. I didn't ever imagine staying here as long as I have, but it works well for me and my family, and I love it. I love to go visit places, but I always want to come back here.
Yeah.
Yeah.
So I assume then, even though you work with other agencies from across the state, in terms, so what do their setups look like compared to our setup? I mean, obviously every region of Kansas and county, we have 105 counties. They're all different, very rural, some of them very urban, others, some have a lot of resources, some have zero resources, quite literally almost. And so how do we compare, do you think, to some of those others, or what do we look like versus some of those others across the state of Kansas?
That's a good question. I get to work with many health coalitions because of the Blue Cross Blue Shield grant that I mentioned, the Pathways to a Healthy Kansas. And they're all so different. I think, and every time I hear from one, I hear something about something really cool that they're doing that I want to learn from. And I think even though, we very different demographics, I talked to very rural health coalitions, some that are like a 3-county coalition. because of population being so much lower. But there's always something that I can kind of learn from and adapt to Shawnee County and to Topeka. I think that what LiveWell Shawnee County does really well, kind of looking at other coalitions, is engaging with the community. On our community health needs assessment, we heard back from 3,000 plus.
Oh, that's pretty good.
Topekans and Shawnee County residents, and that was so exciting. That was a big win for us. So I think we do well at engaging with the community and looking at who we need to hear from more, because we're seeing health disparities in certain populations as worse than others.
Yeah.
I think that our coalition does a really good job of that.
Yeah, because we are an aging population.
We are,
Look at the numbers.
Yeah.
You know, we have, as a city, the county's actually grown a little bit population-wise. Not by huge
leaps and
but as a
bounds,
county, the county's grown a little bit over the last decade. The city has not. Some of those people have either just we've stayed flat. People say we haven't grown, which is true. We've really stayed flat. I think the last one was a loss of about 600 and something people. Okay. And honestly, the majority of those were just people got old and passed away. It wasn't because they left or they didn't like to get, people died, right? And so that's a lot of those numbers are buried in that. But the population we do have is aging. The people who we have replaced have been older people coming in while younger people leave. And so I'm sure that creates a whole different set of variables that have to be dealt with as an aging city and an aging county.
Yes, certainly. Yeah. And that's something I think we have room to grow in talking about how we approach that. We do have someone from AARP on our leadership team, which I think will be really helpful as we explore that more. And then also Habitat for Humanity does a lot of really good work with the aging population in terms of housing, and I've learned a lot from them too.
Yeah, that's great. We my son a few years ago, I think you were giving him out at a fair. Somebody, or at least a vendor at one of your events, was giving out these little pink. They were the syphilis cell. Okay. It looked like a little. If anyone ever go Google syphilis cell, and it really just looks like a little spring.
Okay.
And they put this little face on it, but they were like promoting, hey, take care of, like, don't get syphilis. This is what syphilis looks like. And it was kind of cute. Great. So I took it home. I gave it to my kid. And for years, he played with this little thing among all his other plushies. And then now he's 12, about to be 13. And I'm like, finally, he was like, what is this? I was like, this is syphilis. And he's like, what? And so then we had to talk about syphilis. And I was like, oh, okay. But I joke about that. Like, people, when he played that through the years, like, what is that? I just like, oh, it's just a little character, but
a fidget.
My wife's always like, that's syphilis, man. You let the kid play with it. But it was cute. Had a little face.
I'll have to go down to the basement and see if we still have some. That was before me.
But it was funny, but it was also a good way, I think, to again get the message out there through kind of a fun way of something that people could be like, this is kind of weird, because there were two things given out. I only took the syphilis one, but I can't remember what the other one was. But there were two different cell types of STDs that were being given out that day.
That's very fun.
Probably 6 years ago. It's been a little bit, but yeah, I still have it somewhere at the house. I think. That's what gets the conversation going. Yes, even if it's a weird way
something
to get into
lighthearted.
Yeah, it's fun. It's different, but at least it opens up the conversation instead of let's have a serious talk.
Yes. We got to work with some Washburn mass media students the past 2 semesters who created campaigns, one on STIs and one on maternal health. And they were so good. It just they just made things funny.
Yeah.
Because that's how you catch people's attention on even serious issues.
Well, and everybody's going to take messages differently. I don't know what they called it. I mean, I graduated from Topeka West now in 1994, so it's been a while. But I mean, I don't know what they called the program. I call it the scare. It's just like a Scared Straight version is where they would have the assembly with the seniors. Maybe it was when we were juniors. And they would show you all the gross pictures of what can happen whether some of it was STIs, STDs, some of it was a few other health, like coronary heart issues and other stuff. And they're like, whatever the worst pictures they could find, boom, right there on the giant screen in front. And I mean, you would walk out of there like, oh my Lord.
Exactly positive messaging.
Right. And on the one hand, I know some people though, it worked.
That works, yeah.
And for others of us, we're like, I mean, I'm a little scared for the rest of my life to do anything or go anywhere, but at least I think I learned some stuff. And so, yeah, but you know what? I still remember that to this day.
Yeah.
All those, so I do still laugh about that. It's an example of messaging that maybe it works, maybe it doesn't, but at least they were even 31 plus years ago out there trying to
still stuck in your head.
Get those messages out there in every humanly way possible.
I'll have to talk with the sexual health impact team.
See if they still do that.
Yeah.
See if they still do any version of that.
Yes. Maybe we can bring it back.
Right. Do you go around to high schools and scare the hell out of high school students still, or do you do it a different way? And so, but I think that is the challenge of it. It's so many different people and different ways people process information. How do you get through to them?
Yeah.
So I don't have the answer, but hopefully one of these days you will.
So we recently did some training from the Montana Institute on the power of the positive and positive messaging and the research behind that. So that's kind of my next attempt, but still working on it for sure. Yeah.
Well, do you have questions for me that you would like to ask?
I prepared some. I wrote them down.
That's good. You can write them down.
Okay.
We write stuff down around here. It's
okay.
It's kind of like there's some kind of fly in here that keeps flying around, which the people listening to us now have no idea. Maybe they can see it on YouTube, but it's everything I can do to be like, people hear me clapping. Like, what's he doing? There's a fly. I can't hear the fly. So for everybody listening, there's been a fly.
I haven't noticed it yet, but
that's good. It's only harassing me.
Yeah. Okay, first one. If you had the time, which LiveWell Shawnee County impact team would you volunteer on?
Oh, that's a good question. So I think I would probably volunteer on the housing one and the public safety for the reasons for a couple reasons. First of all, as I illustrate, I think it is a key of all these things to a lot of other things. And so if we can crack that, great. I also try to make sure things that fall into my wheelhouse of where I think I can actually make a difference or help versus, because I've been asked to serve things even before I was elected official. Hey, you'd like to serve on this? I'm like, no, not because I don't think it's important, but I have no skill set for that. I have no reference point. I cannot be of help at all. I can recommend some people who would be great for you, but you don't want me, and because I think sometimes people jump into something and then they realize, this was not a fit. And you got to cut bait and let's the next person who it is a fit and go find something that is. So I think some of those others are areas I just wouldn't know what to do or how to push that rock up the hill with everybody else. But I think that's an area I could. I think as I said, I think housing is one of the more important ones. Do I think some of those other things we talked about, like, mortality rates are at some level more important? Yeah, but put some people who can actually help with that one in those areas who have a reference point for it.
Yeah. No, I appreciate that for sure. Yeah. Because we can't do all the things. No. And if we just focus on one thing we can do.
Yeah. And I've tried to apply that rule to just helping serve on things in general. Because you get asked and I could fill up, I could serve on 20 boards. What's the point? Like, I can't have time to dedicate to 20 boards.
Can't do 20 boards well.
Right. Yeah. And so pick the 3 or 4 and know what your limit is that you can take the time to do. And then to your point, do those well and be a benefit to them instead of just being able to say, yeah, I'm on 25 different boards. Cool. What do you do on any of those boards? I don't even remember when the meetings are, but I'm on them.
Right. Yeah. Yeah. I've seen that before too. And
and that's tough too, because people want to help. And
but it comes from a good place.
Yeah. But like I said, I remind people we are a town of, like I said earlier, over 125,000 people. So there's other people out there who have ideas. It doesn't have to be the same people doing the same stuff all the time.
Right. And that's not as good as
we need to spread around the participation as much as we can.
Yeah. Yeah. I agree. Okay. Next one. What are some ways Topekans can effectively let their voices be heard regarding community and or individual health concerns? Yeah,
I think a couple ways. I mean, obviously just having the conversations help. I know a lot of times it doesn't feel like we're listening, but we are, or at least most of us are. Admittedly, I'm not sure everybody is all the time. Okay, let's be honest. But I mean, we are. It just doesn't always look like it because, as I said earlier, there's a lot of stuff coming at us fast, and so you got to give us time to process it. But never get frustrated to the point where we're like, I sent them something and they none of them heard you. I'm like, well, no, some of us did, I promise. So I think it's as simple as that to start with. But I think the other thing is, I have no problem with people complaining about things. That's
part of life. That's important for us to hear. People don't have every solution. I always tell folks, when you elect people or when you have people work in certain pieces of government, part of the responsibility comes with, I'm supposed to help find some of the answers. I'm not supposed to just say, you give me the answer and I'll make it happen. Nope. Part of why I was elected was to also help find the solutions. Having said that, as we said earlier, I will never know everything about everything. It is literally impossible. Yep. I don't have every answer. I'm not going to come up with every solution. I'm going to hope to put good people in rooms who are smarter than me who can help us get to those solutions. And so I frame that as saying, that's fine. If you've got an issue or a complaint or a concern, bring it to our attention. But if you can, it's really helpful if you follow it up with a solution or a recommendation or a suggestion, even if it's a small one that helps us think about, okay, I'm hearing this is a real problem. I get that we need to be part of the solution team because that's what we're here for. But do you have any ideas? And some of them do, and that's helped. And I've said this for years. There are things we have put in that some years it's things I'll bring to the budget. There's some ordinances we have passed that I have proposed, some rules we've put in place that came from people in Topeka who came to me at one of my open office hours or in a conversation and said, why doesn't the city do this? This is an issue. And I was like, that's a really good idea. You're right. Why don't we do that? And so I wrote it up and I took it to city council, and it's now part of our mode of operations. And so I think, again, to the point is, I think people don't think that happens, but it does. And it's not unique to me. There are several council members who will do that. Hey, I was talking to someone. Why don't we do it this way? Oh, okay. None of us realize, because none of us are health experts. Right. Like right now on our city council, nobody up there is a health expert. No. Hopefully I'm not forgetting somebody in disparity, but I mean, that's nobody's background is in that.
Yeah.
We've got business folks and firefighters and people, but there's nobody up there who's a nurse or a doctor or someone who worked in the healthcare industry, who's been a, food person
with their
or
master's in public health.
Right. Yeah. And so what are we going to figure out as the 10 of us collected, unless we listen to those ideas? So I think it's helpful too, if, like I said, send the complaint. That's fine. That's the process too. But if you can throw in a couple of suggestions, that'll help us think about it a little more and maybe spur something to add to what we're already trying to do.
Yeah. No, I really appreciate that. That's great. What is the best platform for getting your voice being heard? Is it an email?
It's email. It's always emails
always
in this
email.
day and age. Now I say that some of us are, I'm pretty active on social media, and I get people all the time who just direct message me because it's easier for them. They're on the platform. It's right there. So for me too, it's social media is fine. Emails work great because they do. And most council members, again, they do read their emails, so that's always one and a lot of us have our phone out there. But if you got a lot of ideas and you don't want to, take up an hour of our time that we don't have in that moment, but email it's always the key in this day and age. But yeah, social media is not a bad one either.
Okay.
Direct messaging. If they don't want it, they'll block you, I guess.
Yeah.
Actually, I'm not sure we can as a public official. That's a whole different.
Interesting.
There is a law that says, so like most of my social media accounts are just the same account. So sometimes you get city stuff, and then sometimes you're like, why is he talking about his garden on here? I thought that, and because I only have one Instagram account, people, and you're following it, right? I only have one TikTok account, and so you don't know what you're going to get today. Facebook, I do have 2 accounts. One, my elected official account, and my non. But under federal law, they have deemed that you can't block people on your official public accounts. Your private ones, you can do whatever because those are your private accounts. But it's like anything. It's a you can't block people just because you don't like what they're telling you. If you don't want it, then shut down the official account. Otherwise, you're not supposed to just block people because they're supposed to have that kind of access to you. Right. Yeah. And so you got to be careful about that. But it's a good rule from my perspective. Like I said, if you don't have to listen to everybody, I try to, but there's no law that says you have to. Just because they sent you some nasty message doesn't mean you have to listen to it.
Sure. Yeah. No, I learned something new today.
Yeah. So there's a lot of those little quirks out there.
Yeah. Okay, next one, which you already alluded to this happening, but can you share an example of when feedback from Topekans influenced a choice that you made for the city?
Yeah, I alluded to some of it. I talked about if people bring me a good idea, I'll run that idea up the flagpole. I have no problem doing that. I think there's a lot of issues in general, as opposed to maybe a singular decision. I think there are issues where I've thought to myself, "This is the answer. I got this. I'm smart.
I know things, right? I'm educated.
Just trust me.
Right. This is and then you start talking to some people, and the first couple you're like, okay, that kind of made some sense actually. So over time having those conversations doesn't mean I completely change my entire viewpoint, but I certainly maybe wasn't as hardcore, like it has to be that way. You realize, oh, wait a minute. Where I want to get to still makes sense, but the way I was going to get there doesn't. It's not as logical as I thought it was. Right. It's not as helpful to people. It's not as functional. It's not actually serving the needs of folks. And so I think that's where those conversations become key, because how we get there does matter. Yeah. I mean, it really does. You know, in working with the League of Municipalities and being at the legislature, for instance, property taxes is a big issue, both locally and at the state level. There were several bills at the legislature that they proposed that where they wanted to get to, no objection, both as a mayor and as someone who represents the cities of Kansas. But how they wanted to get to that point made no sense. It was not going to be workable for cities. It was actually going to end up costing people more than less, like they thought. And so a lot of my conversations were, I'm with your end game, just listen to us on the middle part. Yeah. And so I try to take that same philosophy. Okay, I think we're all in agreement sometimes on the end game, but I'm not going to understand how to get there the right way if I don't go out and talk to people. And nothing frustrates me more. I can't control any other elected official. I'm not even going to try, and that's their right to be who they want to be. But there are those out there on every level who will say, I know what the people want, and I'm in communication. And then you realize they never return phone calls. They're the ones who don't do emails. You can barely catch them out in public. So when are they listening to all these people and getting that feedback?
How are they getting this information?
Right. It's like they're not. They're living in their vacuum, and then they're just saying what sounds good. And that's their prerogative, and that'll be between them and whoever elects them, and they can work that out. But I've tried really hard. I'm not perfect. I screw it up sometimes, admittedly. I know that. But I really do think those conversations are really important to have to get there the right way. And so I think that's how it influences me more in my decisions is maybe I haven't done a total 180, but I've at least like, oh, you're right. We need to do this a different way.
Yeah, I really appreciate that. That's great. Yeah.
Like I said, I'm going to get it wrong sometimes.
You're human.
Right. Yeah. And I think that's the other problem. I think we don't admit that.
Right. Yeah.
Everyone wants to stand up there and say, especially elected officials, and say, I know what's going on. It's okay when you mess up. You know, we're dealing with that with the budget. We have a budget deficit, and there's some very logical reasons why we're there. But I'm trying to be honest with people and saying, we're not idiots. Believe it or not, we are pretty smart people, and we have good people working and say, we're going to figure it out, but it's not going to be pretty and it's not going to be perfect. You know, instead of saying, don't worry about it, nothing bad will happen. Well, I don't know that. We're going to have to maybe make some cuts, maybe not. But yeah, just having that honesty with people, showing them your flaws isn't the end of the world.
As a voter, I really appreciate that. Yeah. Because we're just all human, and being humble in that, I think, is so important.
Yeah. Because you know what? I'm not going to be doing this gig forever.
Yeah.
And I tell people, I was born here. I'm probably going to be buried here, right? And so what I do in between when I'm not an elected official anymore, at least people can say, he wasn't the best mayor. He did fine or whatever. But at least want to be like, well, okay, he's still a good dude, and we can still talk to him when he's not mayor anymore, and we're glad he's still in the community. You know?
Yeah.
And so I think
can't solve all the issues,
right.
But you can move us closer to progress.
Yeah, I'm not willing to burn down the rest of it the rest of it just because I was adamant that my way or the highway for the next 4 years.
Yeah. No, I think that's great. Yeah. Okay, next one. How do you envision the various sectors making up our communities, business, government, nonprofit, faith sector, working together on important issues facing the community, and then also specifically related to public health?
So I think in part that goes back to what our role is as government. In some of that, we definitely have a role to play, and some of it we need to lead the way. So if we look at our homelessness issue, you know, we've got all these different agencies. And so we've entered into a program a year ago called Built for Zero. Now it's taken us a year to onboard, but we knew that going into it. But the goal of that at the end of the day is that we will then serve as an important hub for all those agencies to be able to work through to access federal dollars and state dollars to then be able to redistribute, and also make sure that there's not a lot of duplication of services, so that so that the limited resources those groups have can be spent on what their expertise is,
where they can make a difference instead of, why do we have 10 different groups doing exactly the same thing, all begging for the same exact dollars? This doesn't make sense, right? And so that's a general concept of how then doing that where it made sense because of the way that program is, just, we should be the hub of it. It makes perfect sense. Everyone's on board. Hopefully in the next couple of months, we're about to the end of our year, and that should be great as we kind of take the next step of that program. There's other issues where, again, it's, I need someone else to take the lead on that, whether that's a business entity, a church entity, a nonprofit, but then come to us and say, I need the city at the table to play this part in it. And so I think that's this, I really do believe you have to, it's not one size fits all. You do have to take it situational to situational. And so I think that's why it's important for us to recognize that, because you do have people like, no, if it worked over here, it's going to work that way over here. No, it's not. The city should not be taking the lead on that issue. Yes, if I need to tweak some ordinances or direct some resources, happy to do it. But I'm not going to there's a lot of issues we have in this community that we can help work on, but we will not get buy-in from the community if the government is leading the way.
From the government, yeah.
Right. And I get that. I mean, it frustrates me at times because I'm like, we actually want to help on this one, but I get it. I get the reticence. I get the concern. And the truth is there's some issues where I've told folks, you don't want to hand us the keys to that issue because we hold elections every couple years, and you might get 3 new council members who have decided, nope, and they're going to, suddenly they're going to take it all away because they're going to vote differently. And then you are now at the whim of elected officials every 2 years or 4 years. That's not awesome for what you're trying to build either. And so make us a piece of it. You don't want us leading the charge on that for those couple of reasons. And so I think we need to be, if it's something we really care about, then we need to play that support role and look at those and trust those groups. It's hard to trust other groups for anybody. It's hard for any of us to get a group of people together and say, I'm going to trust everyone in this room today. Like, I barely know half of them, but I'm going to trust them, right?
Right.
It's
I
hard
think that's
for us
why
to
there's
do
the
too.
silos in like, for instance, the homeless sector or issue that you were talking about. Like, that's can be why there's like 10 different agencies working on the same thing.
I'll bury it all down to this. My wife will tell you that the way I load the dishwasher is not the way you should load the dishwasher. And I will tell you that the way she loads the dishwasher is not the way I would load the dishwasher. But who cares?
Right.
Because at the end of the day, the dishwasher gets loaded and the dishes get clean. So you have a choice in this world. You can fight about it constantly just because it's not being done your way, or you can realize, you know what? We're meeting the goal. Who cares how we got there as long as it's a way that makes sense in the end, right?
Yes, yeah.
And too many people want to fight over about how to load the dishwasher instead of focus on the fact that the dishes got clean. Yeah. And that's where we get in trouble all the time. Yeah. And those are the constant conversations that we have in this community. Yeah. And that's where I think then it takes some of us to cut through that and be like, focus on the goal, folks, not the little, okay, you wouldn't do it that way. Great. Bob's going to do it differently, but he's going to get it done for the collective. Good job, Bob. Thanks, man.
We'll all be better in the end. Yeah.
And so, I think that's how we have to look at it from our seat too is, do I always need to care how the dishwasher get loaded as government? No, I don't. Let's just make sure someone's doing it.
Yeah. Do you have like a system set up for interacting with other sectors like faith and
so
and
yes and no.
business?
Depends on the area. I would argue we're doing a better job of that through, say, our housing services, and we're improving on that through our economic development with our business community. We've a couple months ago, we created an economic development director within City Hall, which we have not had, which is critical. We have to have economic development. And as much as the partnership's great, the chamber's great, but they also sometimes have a goal that's not the same as ours. Doesn't mean we're against each other, but it's just like they think something's important and we say, we agree, but we also have a project that's important for the city that we're going to prioritize. So now we have someone to do that and who can talk with the business community and work through some of their issues. Hey, you're overburdening us. You need to fix. Great. Talk to our element. So I think if we look at some of those, like the homelessness issues, the housing issues, some of our economic development issues, I would say yes. I think if we get into some of those other issues, we don't, because I think sometimes we don't know where should they be directed, like which department is the issue in, and do we have someone there who can help navigate that with them? And maybe that's the mayor's office, maybe it is the city manager's office, but is it a planning issue? Maybe it is a public safety issue? I do think our our chief here, who came in here a little over a year ago, has worked hard to create some of those connections with community violence, anti-violence groups, and community groups who understand that police are important, but sometimes a person wants to talk to a non-police officer to get to where they're going. Yeah. So yeah, I think there's some areas we can point to where like it's actually starting to work, and there's other areas where like I haven't figured out how to crack that net yet, or who we can connect with. Yeah, where we can connect them with in City Hall to be that conduit.
Yeah. That's good. Okay, let's see. What do you see as the government's role in this work, and how do you ensure it stays in its lane for the sake of progress? I think you kind of just answered that.
But you're talking about for the community health? Mm-hmm. Yeah, I think we do need to lean on, well, I don't know, it's the county's problem, right?
Right, it's the health department.
I joke, and this is half true and half joking, but it's half, there's a little truth to this. I got elected, and then COVID was hitting. Yeah. So the first time I ever got into public office, I'm like, the world is, what is happening right now? This is not what I thought it would be.
The only thing we were sure of was we don't know what's happening.
But one thing we knew, as I did learn pretty quick as a city council person, is under our state government, the two people who had authority over most of those decisions were the state and the county. Mm-hmm. So I would get emails like, oh, I can't believe you're doing this. And it was kind of nice to be like, oh, man, I agree with you, but that's the county or that's the state, and step back and be like, what do you want me to do about it?
There's
right?
the website where you can find
I'm like, it's those county commissioners, right? Or, call the governor's office. What do you want me to do, right? Yeah. So that was one time where it was frustrating. I was like, but sure, I'll deflect this back and throw it on the county. So yeah, I did throw them under the bus a little bit, but I'm open about that. So I guess that makes it better. But I think that was I will say what I learned from that though, right away, was how this system works and where you do need to go to if you do want some local decisions made, how you have to build a good relationship with those entities. And I think that's the biggest takeaway, and the biggest way we can help as a city assist in some of these is making sure we have solid relationships as a city government with whether it's the governor's office, whoever the governor is, whether it's KDHE, whatever those entities are that can assist us in this community with those. We need to build those relationships so that we're not just somebody who just asks for something all the time. We're someone who's actively engaged in what they're doing on a regular basis. Yeah. And then the same applies to the county. We need good relationships with our county commissioners. We need good relationships with the county health folks because they oversee what we're doing here and can have real input and impact on what we're doing. And if we, again, even though I threw them under the bus a little during COVID, the real approach is we're in this together. Even though I may not have final authority, I said at a panel I was doing with Commissioner Mays, I said, hey, don't forget, Topeka is one of your children, right? We got several cities and we're one of your children over here. And so don't forget us. And so, but we need to understand that relationship. It shouldn't just be always coming to the county or to LiveWell and say, fix this. We're in the county, fix it. It's what can we also do, but recognizing, but you kind of have more authority, but that's fine. What's my piece of this? But I do think those relations, I did learn that during COVID, is understanding how the system works and having good relationships with the people who have the biggest impact on that system goes a long way to us all working together rather than just creating adversarials, screw you attitudes, or only
this is your thing,
right? Or only reaching out when I need something too. Yeah,
right. Yeah.
Instead of just deflecting it, because it's good. Everything the county does and the state does impacts the citizens of Topeka. So, absolutely, as the capital city, we better be paying attention.
We better, yeah. No, that's good.
Yeah, that was the big take. That was the big lesson I learned.
We learned a lot.
My
of
trial by fire,
COVID, didn't we?
Yeah, that was, like I said, when you have all these dreams, I'm going to go get this stuff done, and then your first year is we're just talking about COVID all the time.
To survive.
I haven't even been to a meeting in public for 3 months because I'm not allowed to do it. Yeah,
what a time! What a time. Okay, these are a little bit more specific. I would say. Okay, so given the 4 CHIP priority areas, what are your thoughts on expanding the work of the city's Public Health and Safety Committee?
Oh, I haven't ever thought I've never been asked about that, actually. I mean, it does have health and safety in the title. I know it spends a lot of time on code compliance, which is a health issue, obviously. I mean, in terms of nuisance and cleaning stuff up. But you're right, it doesn't really deal probably all that often with some of these issues. I mean, I would say that's a good idea. I'm not on the council anymore. They may have thoughts, which has been an interesting. We're a 10-person governing body,
But it's interesting, and I talk to my colleagues about this, and I don't mean it, but like, I'm not a member of the city council anymore.
Right. Yeah.
I mean, I tell people
Your role has changed.
we have four sort of branches in City Hall, right? We got the mayor, we got the city manager, we have the city council, and then we have the public. Right? Those are the four sort of entities that sort of are supposed to be at the top of that chain. But I am my own thing, and there's some things I can do I couldn't do as a council member, and now there's some things as mayor I can't do. Like, I don't serve on any of those committees. I can listen to their recommendations. I can publicly say, great idea, or what are you people thinking? And have a vote and my input. But so I think it's a good idea, though. I think to make sure that public health and safety piece isn't just the safety part, but it's talking about the health a little bit more. Because again, these issues aren't going away for our citizens, and we can't just cede all the responsibility to the county entities.
Right. Yeah. And those 5 domains that make up the social determinants of health all play a part. Yeah.
Well, and I'm sure there's policies we can put in place that even don't have a huge cost to us.
Right.
You know, as I'm looking at putting together some of these various task force that can work with my office, like I'm doing a workforce development one. And I said, look, it's really a twofold piece. It's not just what can we do externally. There's probably some internal policies we can pass, for instance, to make to at least guarantee or at least encourage a contractor. Are you using local subcontractors? Now, there's some state laws that say I can't necessarily require it, but I can encourage it and ask it on a checklist before I bid out the job. Great. Maybe that's a good policy, and they can take a look at that. So that doesn't come with a cost to us at all, but it could really improve a lot of local businesses in our community. I'm sure if there's other policies like that would relate to our health issues, that it's not a money issue. It's actually just if you put a few things into your policies or your ordinances, it would make a difference on some of these issues. And so I'll be honest, in the 7 years I've now been an elected official, those aren't conversations we've been having on the health piece of it. Yeah. And that's probably why we haven't improved in some of these categories.
Well, I'm here to support if there's anything I can do.
No, I mean, that's great.
Yeah. Okay. Regarding the neighborhood safety portion of the CHIP and in the CHNA, those results that we heard from the community, do you foresee expanding the sales tax initiative to include preventative programming and upstream social services as a part of public safety?
Oh gosh, we're gonna talk about sales tax. No, you're good. You're good. So let me break down the sales tax in general. I have concerns with the sales tax concept right now at all. Now, it would help. I'm not saying I'm totally opposed to it. I am always cognizant of the fact that sales taxes can be regressive. And so I do have that concern that if at what point are we, in our effort to try to help things, are we actually creating more harm on the people we're trying to help in some of those zip codes we talked about? Oops, because now it's costing them a little more to purchase things. Yeah. So I think it's very important to me when I look at any sales tax initiative, what's the cost benefit analysis? What's that return on investment to the city versus what's the downside or upside to the citizens, right? So to that, I think what's going to be talked about as we go through the budget will be something that right now is going to talk about a couple of issues. I think housing, which would include things like the affordable homelessness and the Affordable Housing Trust Fund. Our fire, we need some new fire stations. I think a little piece of it would go to help just fund those so it doesn't have, and then just general public safety, police, fire, and code enforcement. That's the plan I've heard. I have not had a lot of input into it, but I mean, again, I think that's what you'll hear discussed. Okay. I would argue the other way to look at that is, to your question is, public safety is by far, it makes up 70% of our budget. And that includes, like I said, police, fire, and code compliance, which I think is important to include because it's under the police department and it does have a public health or a public safety component. I would argue that if we're really going to have a sales tax discussion, maybe it should just focus on going towards public safety itself, not to increase their budget. And I've been clear with our firefighters and our police. The goal of that would not be to give you more, but it would be to take that savings off the general fund, be able to pay for a portion of it now through that sales tax, which would then allow us to support the police, fire, and code enforcement. But then it frees up those dollars in the budget to talk about the programs you are talking about. Prevention. And it gives us flexibility then to make those changes. The downside sometimes of a sales tax, once you lock it in and say it's only going to be spent for this, is that's all it can be spent on. And so if you get too specific, then let's say, I'm going to live in a dream world. Let's say we're like, hey, we have homelessness almost under control. I mean, we're at least at a
a manageable home. We don't actually need all these dollars, but we have to because that's what the voters approved.
Mm-hmm.
I would rather make the case that let's give us the flexibility by freeing up dollars in the budget so we can have conversations with groups like you. So yes, now I have $500,000 to be able to give towards these issues because a big chunk of my 70% of my budget is now being taken care of, a percentage of it, by this sales tax.
Okay.
So that's how I look at it versus making a sales tax. The other thing is this, and I guess this is inside baseball right here.
Mm-hmm.
If you have to explain it too much, what you're asking, you've already lost. It's really easier to go out and explain to people, look, this is about protecting the community. This is about public safety. It's about police and fire and protecting you and then helping us with the overall budget versus if I have to go out and say, okay, it's a sales tax with 7 things. Let's walk through it. Guys have already graded 7 things.
Yeah.
And I think we just saw that in Wichita. Wichita had a sales tax initiative on their ballot in March.
Okay.
It failed miserably. And one of the top feedbacks they got was it had like 12 things baked into it, ranging from some really great things for citizens like housing, homelessness services, some nonprofit services, but also renovating the event center and people were just like, what are we doing here? I don't understand what you're asking me for more money for. So these are the internal conversations I'm having with staff, I'm having with other council members to say, if we're really going to do this, let's make sure it's very targeted. It's actually addressing real issues that our budget has so that then we can help allocate those other dollars for homelessness and health and safety and those kind of things. So there's a lot to it and it's complicated as hell.
I believe you.
Yeah, but it's a worthwhile conversation and we are going to have it over the next several months. There will be no doubt as we'll get hot and heavy into the budget process over the next couple months because we have to have our budget approved before October 1.
Okay.
So we
get here before.
Yeah. We'll have a lot of talks July, August, and September about this very issue. So I encourage anyone who has those thoughts to send them to us because we're going to need to hear that feedback about what the community's really interested in us doing.
Yeah. The reason I ask, I hear of research around preventative programs being so successful, and we've talked a little bit about that already, and I see a lot of work in the community around prevention that seems really helpful.
Yeah.
And I think already we're seeing that, it's successful. And
well, we throw too much money at we throw too much money sometimes at the problem, but not at the core of the problem.
Right. At the Band-Aid.
Right. So
and not the
right.
root.
And so then we can't figure out why are we stuck in the same cycle? Because we're not putting the resources towards the root of the issue, which is why we're just fighting a losing battle. And I think that's something we always have to ask ourselves to your point. It's better to spend more dollars. Yeah, there may be a short-term hurt on that in some respects. I'm going to shift these dollars to what I know programs people love and that, yes, they do benefit people. I get that. And I'm not trying to harm those people.
Because the problem doesn't go away when you start focusing on the upstream.
But if I can make that tough choice and make that shift, long-term, it is better for all these same people. But getting folks to understand, not even that they understand it, but getting them to have that tough conversation and make that very difficult decision and some of the positives you're going to get and the negatives you're going to get, that's hard. And that's what we got to jump over. That hurdle we got to jump over is how do we get people to understand, I get that you're hearing these issues, but trust me, this is a good shift. Let's focus on prevention. And guess what? 5 years from now, this will still be a problem, but maybe significantly less.
Yes. Yeah. No, I appreciate that. All right. If you could have a magic wand creating more funding for the city, which community health issue or issues would you work to solve first for Topekans?
Oh, I would deal with that infant mortality.
Yeah.
The fact that we have, besides the fact that, some of these issues are horrible. That's a horrible problem.
Yeah.
On a lot of different levels. I don't need to explain. Everybody gets it. But and the fact that we haven't made progress there bugs the living hell out of me. It just does because I'm like, really? We haven't improved at all. And I know, and what's even more frustrating is I know there are really good people in this community working hard that problem. They are. And it's not a fault of theirs that we haven't improved at all. Like kudos to them and everything they've put into it and that they're going to continue to put into it. So it is not a reflection of the work they're doing. It's just one of those problems that they need more help.
Yes.
They need more help to solve it. It's as simple as that. And we need to find out how we can get it. So yeah, that's one right off the bat I'd wave that magic wand at.
Yeah. Same.
Yeah.
Okay. So on public health and safety,
Mm-hmm.
sorry about that. There's a staff person from the Office of Inclusive Communities
Yep.
who recently mentioned in a committee meeting that the organizations that they are working with, they just need more money
Right.
for
Right.
their good work.
Right.
So that being said, I kind of lost my train of thought here. 1 second.
No, you're good. Everybody needs more money.
They do.
Me
What's
too.
your response to that? What do you see as?
Well, I do think that's a resource issue and a problem. This also gets in the conversation of, again, if you go and start polling every person in Topeka, you're going to get a different answer to this question. You
Mhm.
might get 100,000 different answers to some
Mhm.
degree, but
Mhm.
and it's, where should I be putting resources? And there's those who are going to tell you, if it's not police and fire and roads and water and a few other core, then cut everything off and everybody can fend for themselves.
Mhm.
I get that. Like, I understand where that thinking is coming from. But at some point, again, we have a responsibility to help deal with other matters in the community. We need a solid quality of life. We need to have some economic development if we want to see some growth, right? We need to help with housing if we want to see growth. So those things aren't going to magically happen on their own without some assistance from City Hall seeing how we can move the needle.
Mhm.
So then we're now talking about everybody fighting for whose program is better. It's kind of like every time we talk about, and we'll do it during this budget cycle, programs we're going to have to make some adjustments to. I will get people who have told me, slash your budget, and one of them will send me an email saying, I can't believe you're cutting that.
I can't believe you did that.
Right. It matters to you, and I
Right.
understand that, and that's important, but this is what I was talking about when I said we had to make tough decisions, right?
Mhm.
And so I think for us, since my pot of money is not going to get bigger and I
Right.
can't just magically solve their problems with more money,
Mhm.
what I can do is, on the money side, is I do think we have a pitfall in the way we've approached some of these organizations to help them bring in other dollars,
Mm.
because some of these grants require having a government partner.
Okay.
Right or
Yeah.
wrong, there's
Right.
some federal grants and even some
Mhm.
state grants that say, yeah, you can't get it unless you have partnered with a city or a county.
Mhm.
Well, we're not doing a very good job having
Mm.
someone on staff or in-house who's like, great, let's go write this grant. Let's see if we can really develop this little piece of a program without adding a lot of workload to our staff. But if
Mhm.
it brings us some money that we can then get out to you, great. So I
Because
think
that investment in the organization benefits your constituents.
Right.
Yes.
Because again, I'm not going to solve these problems, but
Mhm.
these organizations can. And so
Mhm.
I think that's where our focus needs to be, is who can I have in-house that can help find those opportunities to partner with those groups to find those resources for them. And I've talked with a couple of those groups who have said to me, we don't have a bad relationship with the city, but I wish we had a little more, because here's 2 grants that if we had a partnership of some kind, we're eligible for
We'd be
them.
ready to go.
Doesn't mean
for
we're going to
them.
get
Yeah.
them, but right now we're not even eligible for them because, and we just haven't added that sort of person. We've had a grant writer off and on, but they've focused more on what I would call just city grants.
Okay.
And I think we need to expand that to helping with some a community piece of that.
Yeah.
I think
Yeah.
that's where we can actually start to make a difference right now that might help with those problems.
Yeah. No, I love that. That sounds
Yeah.
great and doable.
Yeah, right.
Yeah.
And that's one that's working. Right. That's one we could actually
Take some
do.
steps to
Yeah.
Okay, last question. Maybe
All right.
I have two more questions.
Okay.
But they're easy, I
You're
think.
good.
First of all, what's your favorite book? Just curious.
Oh,
One of your favorite books. I hate when you have to
I know.
narrow it
When
down
you have to
one.
pick one,
Yeah.
I know. Oh, that's a really good question. I don't know that there's one I go back and read a lot, because then I get into that cycle like, well, if I take time to read this one,
Right.
I'm not
won't have
going to
time
read
the
that
new
one.
things.
I remember this is not my favorite book, but before I tell you, biggest book I ever read, and even my teacher thought I was crazy, is in middle school. I was like 7th grade, and she's like, pick a book. And for some reason I picked Gone with the Wind, which is, I think it's because it was my grandma was reading it, and she's like, you should read this. And it's freaking long.
Yeah.
Like
it's
that
a-
book took me like
it's
a whole year to
hefty-
read or so. It took me forever as a 7th grader to read. So I don't know this
a
day
hefty
why
publication.
that's what I call the first, not real book ever, but like super long, crazy book as
Mhm.
was like in the 12-year-old where I'm like, why is he reading? Even my teacher's like, why are you reading Gone with? I don't know. My grandma said to read it. So here I'm
in a book
reading
club
it.
with my grandma.
Right. So here I am. So, because I also try to read, I try to shake up. I try to read dual, like fiction and nonfiction.
Yeah.
I don't just stick to one because
Yeah.
you got to read a little
You gotta mix
nonfiction.
it
But
up.
at some point, you're like, I need to read
need
about
an
somebody
escape.
getting killed and them trying to solve it. As gruesome as that may be, that's what I need right now. I need a good murder mystery. And so I don't know. I still read all the time. I guess a lot of the Agatha Christie books. If you go into our library, we got like all the little paperbacks, but I still have a bunch of the Agatha Christie stuff. So I don't know if I have one book of hers, but I've read a lot of the Agatha Christie stuff.
Okay.
I can always go back to her.
Yeah. That's a great answer.
Yeah.
I love that. Okay. Last one. What do you miss about Topeka when you leave town?
Yeah, that's a great question. Because I always joke, my wife, I joke sometimes whenever I drive right back and you see the "Welcome to Shawnee County," I'm like, it feels different. Like, yes, I can feel it. I don't need the sign. I can feel when I cross into
The
Shawnee
air
County.
is clear.
That's right. I'm like, this is it. This is home. I'm right here. I think for all of our problems and warts and other issues, I think getting out and about in the world has shown me that a lot of those warts and issues are not unique to us.
Mm-hmm.
It feels like it when you live here and in the
Mhm.
moment. And if you don't move out around, and that's fine. But you're like, when I get those emails or calls, like, this is only a Topeka problem. It's really not. Like, doesn't mean we shouldn't solve it. And
Right.
it's definitely a problem, but it is not a Topeka problem. It is a universal problem for a lot of cities. And so, I think though, when I come back to Topeka, just growing up here, as silly as it sounds, I think I just miss being in Topeka. Like it's its own vibe. It's your hometown. You know people. I know where stuff is. Like it's a comfort. It's just being home in my city is a true comfort for me. And I know that's not it for everybody. There's lots of people who are from here who still live here. Like, yeah, it's just my home. I'm like, it just feels different when I come home. I'm like, yeah, I'm back. All right, life's good.
Settle in.
Yeah.
And yeah.
So I think it's that. It's just that general sense of I'm home. Great. It feels right.
Yeah. No, I can resonate with that too. Yeah.
Yeah. So that's good. Yeah. Well, I appreciate it. It's been good. Anything else you want to add about anything you guys are doing, or how do people look you folks up? Let's go there. Let's tell them how to connect with LiveWell.
Yeah. So we have a website where you can easily get connected. And an email would go right to me. That's livewellsnco.org. And then also our social media is a great way to see what we're doing and to get involved or get in contact with us. Those are two really probably the easiest or probably the easiest ways. I think my phone number is on the website. I'm pretty sure.
Somebody's.
Yeah, somebody's is. And we're always looking for more coalition members too. So if there is an area that folks are interested in or have some expertise in, that is a great way to get involved in the work and be a little bit more boots on the ground. We always need more perspectives and ideas. And also, if you don't have the time or capacity to get involved in the coalition, like look at what you're already doing and see how maybe you could start a conversation around.
Fit in.
Yeah, like if you're in a book club or a church group or a knitting club, like bring it up maybe sometime, like the chip or something that you've learned about and that's involving public health in our community and see what small thing you can do. It makes a difference.
Well, thank you for being here. Appreciate it.
Yeah, thank you so much.
It's been great.
Yeah, this is my first podcast.
Yeah, see, there you go. Thank you, everybody.
The Civic Circus Podcast is a production of Capital Connection, LLC, and Voiceland Media.